Bismillah ar-Rahman ar-Rahim. In this chapter, we will start with the skin integrity and wound care. So we will start with the skin or the cubitus ulcer. Factor that affect the skin integrity. The first thing, which is the genetic and hereditary factors. So genetic and hereditary factors, they are affecting the skin by sometimes the in white people they are more sensitive to the sunlight, and it might affect their skin and it might cause cancer on those people. Also, there are in some people there are some problems with their skin that might interfere with the skin integrity and also increase the susceptibility to have disease. The age itself, by the age in infant and old age, their skin is more delicate and it is more prone to injury. Chronic illnesses. In case of chronic illness, due to the chronic illness itself, it might lead to emaciation of the body and including the effects in the skin and subcutaneous tissues, that it might be less and it will increase that also the cushion which was there due to presence of fatty tissues in the subcutaneous tissues, it will be diminished, and this increases the possibility of having pressure over that skin between the bone and the surfaces of support that we are sitting on or lying on. A treatment regime that we are using. So some medication that we are using, it might affect, like tetracycline, it might affect the skin sensitivity to sunlight or enhance the skin sensitivity to sunlight. Medication, as we said before, that there are many medications that interfere with the skin sensitivity, like also steroid therapy. It will make the skin thin and more prone to infection and sensitivity. Poor nutrition, it will lead to loss of subcutaneous tissues, subcutaneous fat under the skin, wrinkle of the skin become weak, and it will be affected by any injury. Pressure ulcer, what we mean by pressure ulcer, it is called pressure ulcer or decubitus ulcer or bed sore. So there are many names of that pressure, and it means the same. So the pressure ulcer, it is injury to the skin and the underlying tissues. It is mostly over a bony prominent area, which is result either from the force alone or the force with the combination of movement. When we are moving the client, there might be some, what we call it, the shearing force, that it will interfere with the tissues and it will lead to more, the client will be more prone to injury of the skin and the underlying tissues, that it might be changed to decubitus ulcer. The other thing, which is, as we said, we call it pressure ulcer or pressure sore or bed sore or decubitus ulcer. Why we are calling it bed sore? Because mostly those who are confined to bed for a long period of time, there are a lot of changes that will happen in their body, in their circulation. The circulation, it will be weak. Also, the pressure, it will be over a certain area, especially if they are unable to move, and by that it will increase the possibility of forming bed sore or the cubitus ulcer. The cubitus ulcer, it can range from a simple redness just in the surface of the skin to a deep wound, a deep necrosis of the skin, the underlying subcutaneous tissues, and even it might go toward the muscles and might reach even to the bone if we are not dealing with it in a proper way. The etiology of pressure ulcer, what will happen? When the client is lying for a long period of time, what will happen to the tissue? The bone itself and the heaviness of the body, it will compress the skin between the bony prominent area and the bed that we are lying over. So that compression, it will affect the blood vessels. So the blood vessels, usually they are patent while there is no compression over them. When compression is there, this will lead that compression also, it will compress the blood vessels. So there will be narrowing of the blood vessels. So the blood supply to the area, it will be diminished, and the oxygenation and metabolism in those tissues, it will be less, and it will lead to ischemia. There are other factors that might lead to ischemia, which is thrombosis also, and also formation of what we call it, the bad of formation of fats in the wall of what is atherosclerosis or sclerotic changes. Also, it will affect the blood vessels wall. So ischemia or loss of blood supply to the area, it will diminish the oxygen and the nutrient supply to the blood, to that tissues, and including the skin. That this will enhance the formation of pressure sore. So the risk factors of pressure sores, and lying on bed for a long period of time, in this case there are many forces that affect the heaviness of our body itself. So when we are in this position, in a semi-sitting position, there will be many areas that it has pressure. So we are supporting our back to the back or to rest of the bed. So here there is a pressure. Also there are pressure on the buttocks. There are also the skin is bent and our body is taking by the gravity. It is pulled toward the downward toward the legs or the feet of the bed. By that, the pressure is preventing also, and the friction is preventing our body from sliding downward. So that pressure of and the force of gravity that is there and the friction, they will form a shearing force that with a different direction. So the shearing force, that shared force, it is the friction is pulling the body upward, and the force of gravity is pulling the body downward. So it will affect the internal tissues of the body. This is about the shearing force. So friction and shearing force will be there. Immobility. Due to immobility, also the activities or the circulation, it will be there will be stasis some time in some that we can say that stasis is there. So the movement of the blood, also the circulation, it will be weak in case of immobility. Activity, it will enhance the heartbeat and it will enhance the circulation, but immobility, it will decrease the circulation and the heartbeat in this case. Inadequate in nutrition. When inadequate in nutrition, our body is in need for nutrition for the repairing of the tissues that or the cells that daily they are changed, and in this, and it need also the oxygen. So when there is diminished or inadequate in nutrition, in this case, the tissues that died due to the age of that tissues or that cells, it will not be renewed, and by that there will be emaciation of the skin and loss of mass of the muscle, and also the skin, it will be thin. Fecal and urinary incontinence. Those who are having fecal or urinary incontinence, they are more prone to bed sores than others because of many factors. One of the factors, which is the wetness that they are having. So when the tissue is wet, it will increase the possibility of maceration and laceration. And also, urine and feces, it contain digestive juices, digestive enzymes. Those digestive enzymes also, it will act on the skin, and it will lead to breaking down of the skin if we did not keep the skin dry and clean. In this case, the possibility of performing bed sore, it will be very, very high. So always, if the client is having urinary or fecal incontinence, we have to be more cautious. We have to keep him as clean and dry. So we have to change the diaper for them and to change the bed linen whenever it is needed. And we should not keep it wet. Decreased mental status. If there is any effect on the mental status of the client, either if it is due to mental retardation in case of mental retardation, or if it is due to the disease itself, or if it is due to the medication. The decrease in mental status that might be affected by the drugs that we are taking, by narcotics that or strong sedative that is given to the client. It will make him confused, and he will not realizing the need for movement. He is not realizing what is going around him, and by that it will increase the possibility of having a bed sore. Diminished also sensation, like in case of paralysis, like in case of diabetes. So the client will not feel the pressure. Usually, as an active person, when you feel the pressure, you will change your position. Even if you are sitting, even if you are lying, you will change your position. You will move every now and then. By that movement, it will enhance the circulation, and also it will enhance the aeration, and also the circulation of air around our body, and this will prevent the moisture and prevent also the or decrease the pressure and enhance the circulation. But When there is diminished sensation, in this case, we will not feel the pain, we will not feel the pressure, so we will not feel the need for changing our position in order to decrease those bad sensations. So because of that, the pressure, it will be exerted for a long period of time. It will lead to diminished circulation. It will lead to diminished nutrition to the tissues. It will lead to diminished oxygenation to the tissues, and then it will lead to necrosis of those tissues and bed sore. Also, excessive body heat in case of high temperature. In this case, you know that there will be more sweating, and the wetness which will be there due to sweating, and also the excretion from the skin. It is not only the water, it includes also salt, which is irritant to the skin. That wetness and hotness, also it is a good media for the bacteria, so the bacteria, for the bacterial growth, and all of those factors, it will enhance the formation of bed sore and breast. Advanced age. In advanced age, there will be loss of body mass and thinning of the epidermis, loss of the skin elasticity. So the skin will losing its elasticity, the skin will lose its vitality, and also the blood supply to the skin, it is less. Dryness will be there, decrease pain perception and feeling. Also aging of vascular wall, that also will interfere with the oxygen chain exchange and also nutrient supply to the tissues. Presence of certain chronic condition or diseases, also this will enhance the possibility for formation of pressure sore, like as we said before, in case of diabetic client or obese client, also it will enhance this possibility. If there is the client is confined to bed for a long period of time for any cases or any chronic condition like heart failure, heart problems, in this case also it will affect the skin. Other factor, poor lifting and transferring technique. So it is not only the pressure of the body, it is the transfer technique and changing position technique. If the nurse or the caregiver is not taking care properly and changing the position in the proper way, this will enhance what we call it the shearing force, and it will enhance the breaking down of tissue from underlying the skin. So this will lead to pressure sore or bed sore. Incorrect positioning. If we are not positioning the client in a proper position, and if we are not, we have to change the position of the client every now and then. It is the maximum. She should not be staying in the same position for more than 2 hours, and also that is too much. We have to change the position if it is possible more frequently. If it is every 30 minutes, that would be good. Hard support services. If the bed is hard, and this will increase the possibility of pressure over the bony prominent area, and the bed, it will not take the shape of the body, by that it will enhance pressure in a certain area, especially over bony prominent area, and enhance the possibility of forming bed sore. Incorrect application of pressure relieving device. Even the pressure relieving device, it is designed in order to decrease the pressure and to prevent the pressure sore. But if we are not using it properly, if we are not applying it in the proper way, in this case, those device itself, it will create pressure in a certain area of the body of that person, and also it will lead to pressure sore on that area that it's creating pressure over them. About the area which is more prone to pressure sore in a supine position. So when the client in a supine position, he will be prone to a bit sore in the back of the head, the cubitus bone. So in this case, we have to check for bit sore on the back of the head. We have to support the head by some soft pillow in order to avoid the formation of bit sore. Also in the scapula, in the back, also in the elbow, at the elbow, the urinary process, at the sacrum region, and the heels, the calcaneum. So those are the main side which might be exposed to bed sore due to the lying in bed in supine position. So we have to assess those areas more frequently in order to avoid the formation of bed sores, and support those areas. We can support them by some rolled sheets that it will or cushions that will divide the force of the gravity and the force of our body on a larger surfaces. By that, it will decrease the possibility of formation of bed sore. In lateral position, we have the ear also is more prone to bed sore. The side of the head, the parietal and temporal bone, the shoulder also, the cranial process, ilium, the iliac crest here, also the greater trochanter of the femur will be prone to bed sore. The knee, the medial and lateral condyles, and the malleus, the middle and lateral bone. So those are more prone to pressure. And you know that the skin over those bony prominent is thin. In prone position, cheek and ears, the zygomatic bone also is more prone. Shoulder, acromion process, the breast in women and even in men, genitalia in men, knee and patellas, and also the toes and phalanges are more prone to formation of bed sore. In falar position, vertebral spinal process will be and sacral, also the pelvis, ischial tuberosity, and also the heel and calcaneum. So those are the site which is more prone to develop bed sore, and we have to assess them more frequently and to take care of them more frequently in order to prevent the formation of bed sore. Because bed sore, when it is formed, it is difficult to deal with it. But if we are able to prevent the formation of bed sore, that will be better, and it will take a little care than rather than taking care of the cubitus ulcer. About the stages of bed sores, there are 4 stages. Stage 1, sore here is not open wound. The skin may be painful sometimes, but it has no break or tears. The skin appear, usually it will appear red. So redness of the skin. So the epidermis, it is intact. The dermis also is intact. Subcutaneous tissues is there and muscles here. So nothing is there, but only you will find that redness will be there. So this is the redness that you might observe first. So this is the first stage, only this redness. The second stage, here see the changes. The color start to be there are some vesicles, there are some breaking down, small breaking down. The color is also not red, it's going toward black. So the skin break open, which is usually tender and painful. The sore involve the epidermis and the dermis. So epidermis and epidermis are involved. It can look like a scrub or abrasion, or it might be a blister. Sometimes look like a blister filled with clear fluid, like in case of the second-degree burn. The stage 3, the sore here is getting worse and extend into the tissues beneath the skin. So it's affecting the skin and start to affect the tissue beneath the skin. A small depression will be there. Fat may show in the sore, but not the muscle here. So it is not reaching the muscle and not reaching the tendon or bone. There may be little or no pain due to the significant tissue damage. So the nerve ending is damaged here, and mostly in those patients also their sensation is affected before the bed sore itself. Serious complication, or they might be unconscious because of that, they are not feeling and that they are not complaining. Serious complication such as infection of the bone and also blood or septicemia might occur due to that. The stage 4, the pressure sore is becoming very deep and it reaches into the muscles underneath the skin and also it might reach to the bone and causing extensive damage. So the damage of deeper tissues, tendons, joint may occur. There may be little or no pain due to significant tissue damage. Serious complications such as infection of the bone might happen. So it might lead to gangrene, it might lead to infection of the bone, and in this case, it is difficult to deal with it. Risk assessment tool for bed sore. There are what we call it burden scales for predicting pressure sore risk, and there is Norton score area risk assessment for assessment scale. So about the burden scale for predicting pressure ulcer, we have to assess the client for 6 categories. The first one, so we have to assess him for sensation and perception, for moisturing, for activity, for mobility, for nutrition, for friction, and shearing force. So for sensation and perception, if the client is completely limited sensation of pain, sensation of all the senses itself. So if it is affected, in this case, he will be more prone. So he will get only 1 mark. If it is very limited, he will get 2. If it is slightly limited, just he can sometimes he did not feel the pain, he feel numbness is there. It is will get 3. If no impairment, nothing is there with all the senses, in this case he will get 4. About the moisture, when he is constantly moist due to any cause, like fever or anything, and sweating is there, in this case he will get only 1 mark. If he is most often moist, so concurrently sometimes he is becoming dry, and but most often his body is moist, in this case he will get 2. If he is occasionally moist, so just maybe half an hour or within the day he will become moist, in this case he will get 3. If he rarely become moist, always his body is dry and clean, in this case he will get 4. About the activities, if the client is bedridden, cannot move from the bed, he will get only 1 mark. If he is confined to chair, he can move from bed to chair, in this case he will get 2. If he can occasionally stand and walk for a short period of time, but he is not that much active, in this case he will get 3. If he walk frequently, can go out of bed, in this case he will get 4. About mobility, if there is completely immobility, so in this case he will not be able to move any part of his body, he might be unconscious, so in this case he will get only 1. If he has limited mobility, either due to weakness or either due to limitation of movement due to pain or due to disease that prevent him from moving, in this case he will get 2. If he have slightly limitation of movement, like also in case of joint pain, it will affect both. In this case he will get 3. If no limitation of movement, he can move all the joint freely, no limitation of any joint, in this case he will get 4. Nutrition, very poor nutrition emaciated, in this case he will get 1. Poorly inadequate, so he is taking nutrition, but it is very less than normal, in this case also he will get 2. Adequate nutrition, he will get 3. Excellent nutrition, he will get 4. Friction and shearing force, if there is problem with friction is there and shearing force is there, in this case he will get 1. Potential problem, if it is a potential problem for friction and shearing force, he will get 2. If it is not apparent as a problem, he will get 3. So if we calculate that score, and he got from 13 to 15 to 18 score, if his score is from 15 to 18, he will be at risk. If it is more than 18, he will be safe. If it is from 13 to 14, he will be at moderate risk. If it is from 10 to 12, he will be at high risk. If it is below 9, in this case, he will be at a very high risk for developing bed sore. So this scale, we are using it in order to find out if our client is at risk of developing bed sore or not, and in which category of having is prone to bed sore. The second one, which is Norton Pressure Area Risk Assessment for scoring system. One, it also the general physical condition, they include the general physical condition, the mental status of the client, the activity, mobility, and incontinence. So nearly both are similar, but they are different in the calculation of the marks. So in general physical condition, if the general physical condition of the client is good, in this case he will get 4. If it is fair, he will get 3. If general condition is poor, he will get 2. If it is very bad, he will get only 1. For the mental status, if he is alert and can respond to all stimuli, he will get 4. Sensation is intact. If he is apathic, in this case, he will get 3. If he is always confused, he will get 2. If stuporous and cannot respond properly, he will get 1. The activity, if he is ambulatory, can move, he will get 4. Walks with help, he will get 3. Chair bound, he will get 2. Bed fast, he will get 1. Mobility, full mobility, he will get 4. Slightly limitation of mobility, he will get 3. Very limited mobility, he will get 2. Immobile, he will get 1. About incontinence, if it is absent, there is no, if he can control the urination and defecation, in this case he will take 4. If it is occasionally incontinence, like every 2 or 3 days, or there are some dribbling of urine, in this case he will get 3, or every day. If usually urinary, he will get 2. If it is double urinary and fecal, in this case he will get 1. So by that we can assess the client ability, or the client if he is prone to bed sore or not. About the assessment, when we are assessing the client, we have to assess the nursing history of the client. We have to review the systemic review of the client. We have to assess his systemically, to physical assessment to be done for the client. We have to ask also to take a history of skin diseases, if he is having any skin diseases, previous bruising that he might have, general skin condition of the client, skin turgor, vitality of the skin, skin color, rashes, any abrasion, all of these things should be assessed. Skin, if there is skin lesion is there, any wound, unusual healing or sore is there. Also, we have to inspect and palpate the skin. We have to see the skin color and distribution of if there is any change in the skin color. Skin turgor also, if there is presence of edema, when edema is there, it will enhance or increase the possibility of forming of bed sore, because the edema itself, it will interfere with the oxygen exchange and nutrient in exchange, and it will compress over the nerve and the blood vessels. Characteristic of any skin lesion, if it is present, so we have to describe that region, the color of the lesion itself, the size of that lesion, the depth, if it is deep or not. If there is excretion from that lesion, we have to see what kind of excretion is there. Is it a pus excretion? Is it a serous fluid? So we have to, is there any smell coming out from that excretion or that lesion? All of those things we have to describe them, and we have to measure that that lesion. So if any lesion is there, we can describe it that it is, as a sample, it might be a redness with 4 centimeters in diameter at the heel. So this is one of the description. The presence of area that are most likely to break down. So we have to assess the risk of breaking down of the tissues, if it is there. Location of ulcer in relation to bony prominent area, if there is an ulcer. Size of the ulcer in centimeter, including the length, width, and the depth of the ulcer. Stages of the ulcer. Is it in the first stage, just the redness, or the second stage, there are blister or breaking down of the skin, but not going beneath the skin. Stage 3, going toward the subcutaneous tissue. Stage 4, which is in this case a very deep wound. Color of the wound and integrity of the surrounding skin. To see the surrounding skin, is it more prone to develop necrosis and ulceration or not? A clinical signs of infection. If there is redness, hotness, swelling, pain, odor, and also the color of the area. So we can measure the size of the ulcer, and we can measure the depth of the ulcer by using sticks or padded sticks with a cotton swab to measure the ulcer, and also we can take a swab for culture in order to assess. We have to assess. So here, this side, as it's apparent, it is in duration of redness. So it is not only the breaking down of the tissues. So you can see that the breaking down of the tissues of the open wound, it is around 4 centimeter, more than 4 centimeter. The depth, after we take off that stick, we can also measure how much the depth is. Also see the color here, the white discoloration, and it might be excretion, it might be pus is formed here. The duration of around the wound, it is more than 15 centimeter redness around the wound. So by that we can also assess the wound and to take care of it. Laboratory data, we have to look for leukocyte or white blood cells in order, because if infection is there, white blood cells count, it will be high. Hemoglobin level, if it is low, it means that the exchange of gases and transfer of oxygen to the tissues it will be low. So we have to maintain the patient hemoglobin level and to enhance his nutrition and to enhance the exchange, and he might need blood transfusion. Blood coagulation status also, it has to be studied. Is there any possibility of bleeding or coagulation? Serum protein albumin analysis for the client, and also this, because if the serum albumin is low, in this case, due to the level of osmolarity, the fluid, it can go outside the blood vessels and it might lead to edema, which will increase the possibility of bed sore. The result of wound culture and sensitivity. So depending on the wound culture and sensitivity, we have the physician will order the type of antibiotic in order to decrease the infection and to prevent the infection from transmission to the internal body tissues. This is how to take a culture swab. And culture swab, it has to be taken with a sterile, this is sterile probe, and we have to use sterile gloves, and before that we have to clean the area of the wound, and we should not touch any side of the patient body from outside. Implementation here, treating and prevention of pressure sore. We have to, in order to treat and prevent pressure sore, we have to provide a good nutrition. If we are maintaining good nutrition for clients who are at risk of developing bed sore, this might prevent the formation of bed sores. Maintaining skin integrity. If we are maintaining skin integrity also by cleaning of the skin properly, bathing of the client. So daily bath, it should be there, or it might be even more than once daily. It might be every shift, and whenever the client is having witness, or if he is having incontinence, we have to wash his body part properly. Otherwise, he will be more prone to emaciation of the skin. He will be more prone to bed sore and necrosis of the skin. Avoiding skin trauma, especially in those clients who are at risk of developing bed sore. Changing position properly and getting help while changing the position in order to avoid the shearing force. Providing supportive device for the client, using air mattress, using also foam mattress, using electric bed for those clients, changing position more frequently, using cushions. Cleanliness is the most effective way of prevention and also treatment of bed sore. If we are keeping the client clean, dry, in this case, almost we are running the halfway of prevention and treatment of the bed sore. So always keep in your mind that your client should be in clean and dry and also active. If he is unable to move, we can do exercise for him, even if it is a passive exercise, changing position every now and then, even less, if it is less than 2 hours interval, that will be better and good. So those are the sites that you can see or watch some of the videos which will explain for you the type of bed sores and the care for bed sores. Thank you.